Hello, my name is Conrad Clark, and welcome to my Week 2 assignment of Agency Regulations in Healthcare. For this assignment, I will be exploring standards of care and the impact that they have on consumer healthcare. I will also be analyzing two agencies, such as JCAHO and HITECH, and evaluate how healthcare facilities comply with those established standards of care. The healthcare system in the United States is driven by government-enforced regulations that control and sometimes can govern the type and quality of care that is available to patients. Regulatory agencies monitor individual and corporate healthcare practitioners and facilities. They improve the quality of care for patients by following local, state, and federal guidelines. Healthcare is so heavily regulated to ensure that patients are receiving safe and high-quality care. The role of these regulatory agencies in healthcare is to protect consumers from health risks, provide a safe working environment for healthcare professionals, and ensure that public health and welfare are served by health programs. The quality of care is monitored by the Joint Commission on the Accreditation of Healthcare Organizations, otherwise known as JCAHO. Healthcare facilities that receive Joint Commission accreditation can participate in the federal Medicare program. Joint Commission surveys are designed specifically for each organization and are meant to guide and evaluate their performance in patient safety, treatment, and quality of care. JCAHO develops their criteria based on feedback from consumers, healthcare professionals, and the governing agencies. One of the major challenges of meeting these quality care standards is that most state governments will require healthcare organizations to receive Joint Commission accreditation as a condition for licensing and Medicaid reimbursement. The Joint Commission accredits all types of healthcare organizations such as hospitals, home care facilities, nursing homes, and ambulatory services. Each area has different standards they must follow. There are currently 250 points of accreditation standards. These standards cover infection control, medication safety and management, error prevention and reporting, staff credentialing and certification, emergency management, patient rights, privacy, and education. JCAHO also maintains patient safety by ensuring that all medications are labeled correctly, two-factor identification for patient's name, date of birth, and medical record number so that they get the correct medication and treatment, and also checking for contraindications or allergies to certain medications. Congress passed the Health Information Technology for Economic and Clinical Health Act in 2009. The purpose of HITECH was to encourage the execution and use of health information technology. Introducing this law helps enhance quality of care and patient outcomes. As a way of encouraging organizations to implement electronic healthcare systems, HITECH offered incentives in Medicare and federal Medicaid. This act transformed relationships among healthcare workers, facilities, and consumers by focusing on the implementation of electronic health records. In healthcare, each patient creates a large amount of medical information known as their patient record. Medical records contain their health information such as hospital visits, number of days stayed, treatments given, medication lists, lab results, and a numerous amount of other information. With patient health records being accessible electronically, there is an emphasis on privacy and security, which then brings in the Health Insurance, Portability, and Accountability Act, otherwise known as HIPAA. HIPAA is an act that ensures patients' medical information is secure and private as a result of HITECH. In summary, the Joint Commission aims to continuously improve the quality and safety of healthcare and motivate healthcare organizations to succeed in providing safe and effective care. The HITECH law implements and enforces the ideas of HIPAA and its regulation of patient security and privacy. In addition, this law provides monetary incentives and negative incentives of fines and the threat of persecution. These are the references that I used. Thank you very much for taking the time to listen to my presentation.